We're now going to have on Birgit Laskowski. I'm telling you, folks, call anybody that you know, have them on the line, anybody who's got a child who has asthma, anybody who's got a child who has dental problems, who has the need for various kinds of dental apparatus to straighten out their teeth. You're going to be just excited about this. Okay, so Birgit, are you there?
Yes, I am.
Oh, wonderful. So take it away, Birgit. Do you want to tell a little bit about yourself and then how you came to Buteyko and then your story?
Okay. Yeah, thanks for having me on your program today. I think it's really exciting that people can learn about this connection between breathing and their overall health, and I'll just focus more on oral health today. So I've been working and living in Smithers, British Columbia, that's in Canada, for a number of years now. I work as a dental hygienist and a certified teacher, and I'm also currently pursuing my master's degree in counseling. I'm also a trained Buteyko educator, and I offer Buteyko breathing courses on a regular basis to adults and children. I initially took a Buteyko course because the dentist that I work for, Dr. Dan Kinkella, is very interested in addressing breathing issues as they relate to jaw formation and teeth positioning. But let me just digress for a minute. First off, I want to say how privileged I feel to be working in a dental clinic with this incredibly forward-thinking dentist and staff. The work that they're doing is really first-rate because they're looking out for the best interests of their patients on a long-term basis. And the reason that I say long-term is because in this clinic, the whole person is looked at, not just their teeth. So this is a general practice dental clinic in which we see quite a variety of patients. Smithers is a pretty small community, so we don't have any specialists here that we can refer our patients to. And if they do need a specialist, they have to travel an incredible distance to get that special care. So what we do is do the best we can in addressing the issues that are presented to us on a daily basis. So in caring for these patients, Dr. Kinkella noticed over the years that in some of the patients he was seeing with temporomandibular joint dysfunction, or some people call that TMJ problems, and the people with sleep apnea, he noticed that they have a similar facial profile to the kids who need braces. So he started to take a closer look at these people, and he realized that if you turn the clock back, the problems that these patients were experiencing stemmed from a mouth-breathing habit in childhood. So he decided that it was appropriate for the staff at the clinic to address this issue. So the staff received training in the Buteyko breathing method, and now we use that in conjunction with myofunctional therapy and appliances. So when we have a mom come in now, and she's asking about getting braces for her little girl who has crowded teeth, we take a really good look at this girl. We take measurements to check the distance between the top of her teeth and the tip of her nose. We look at how high her palate is. We take an x-ray to check how her temporomandibular joint looks and how wide her airway is. Now I want to mention right off the bat, a person's airway is of critical importance. If you think about it, every living organism has some form of an airway. And for mammals like ourselves, keeping the airway open is a matter of life and death. So a human can live for a month without food, a few days without water, but you can only survive for a few minutes without air. So let's get back to this little girl that came in with her mom, and she's got these crowded teeth. I'll call her Susie. Susie's 8 years old, and it's looking like her teeth are crowded, crooked, too close together. She's a nice-looking girl, and her parents, like most parents, just want what's best for their daughter. So the usual course of action would be to ensure she's got straight teeth by putting braces on them. But then you have to ask yourself, why are her teeth coming in crowded together like this in the first place? I just want to diverge a little bit at this point. I'd like to ask your listeners a question. How can beauty be defined? And I'd like to suggest an answer. 1.618. Now, the mathematicians out there are going to recognize this number as part of the golden proportion. In nature, in architecture, art, human body proportions, you'll find the ratio of 1 to 1.618 over and over again. It's found in the pyramids, Notre Dame, the CN Tower, in famous paintings, flowers, birds, it's everywhere. So when you're looking at the human face, this number also correlates to what is considered attractive. The golden ratio applies to the distance between the lips and the chin, which would be 1, and the lips to the eyes, which would be 1.618. Or if you're measuring the horizontal span across a face as compared to the vertical distance, once again, it corresponds to the golden ratio. In fact, this ratio applies to many aspects of the human form, the whole human body, and the face. So if you take what are considered really attractive people and apply this ratio to their features, it fits. And it doesn't matter what gender you're talking about or ethnic background. Now, in terms